We'll wait just a couple minutes while everyone's coming in. Okay, it looks like most everyone's joined. So welcome to the Healthcare Lounge. Our topic today is compliance, and our guest speaker is Jen Berman of MZQ Consulting. So I will turn it over to Nelson now.
Thanks, Kendall. Great to have everybody here. This is a topic that I am told by our guest that we should pay a lot more attention to. So to honor that, I am delighted to have with us here in the Healthcare Lounge the star of CNBC's breakout hit, Listing Impossible, Jennifer What? That's the wrong. Oh, hold on. Give me a second here. Okay, Jennifer Berman, attorney, MBA from MZQ Consulting in Baltimore, Maryland. So it is a pleasure to have Jen here. Now let me tell you why you need to listen to what Jen has to say, because all of these media outlets look to Jen Berman for her expertise on compliance around employee benefits, ERISA, and healthcare. So it is a pleasure to have her with us. And I should mention that Jen is one of the Next Gen Benefits Network's subject matter experts. We call them the A-Team. Jen heads up our regulatory area as Director of Regulatory Compliance. So enough of the PowerPoint. Let me get rid of that and bring up Jen Berman. So Jen, great to have you here. Actually, Jen called me last night from Paris. And I said, Paris, Texas? And she said, no, the Paris Hotel in Las Vegas. So I thought, because she was supposed to be back in her office today for this, and her flight was canceled. And I'm thinking, how in the world was she going to get from Paris back to the United States in time for this anyway? But it turns out that she is in the Harry Reid Airport in Las Vegas, coming to you live through the technology courtesy of Apple and her iPad. So Jen, let's jump into this, because I have seen what looks to be a flurry over the last year or so, probably the last 2 years, a flurry of new regulatory rules, but ones that really seem to be affecting the advisors and brokers in this industry. True?
False. It's really not a flurry. It's much more of a monsoon, Nelson. So honestly, I describe this as being far more than the ACA from a regulatory perspective. And what I'm really talking about are the legal changes that are being brought about as a result of the CAA, which someone recently pointed out to me is really just ACA scrambled, right? So we just rearranged the letters, think about it. But the CAA 2021, which was one of the giant stimulus bills. It was one that was passed on December 27th, 2020. And really it's the No Surprises Act that was in there. And so that was where we got the surprise billing prohibitions. But there were also a series of other statutory changes made there. And with that, we've seen a whole bunch of new fiduciary duties come about for plan sponsors. And huge set of new rules. And to be quite honest with you, I think we've been, and by we, I mean the benefits industry, the Department of Labor, the IRS, the whole sort of complex of the planned world, a little bit of sleep at the switch in not realizing sooner just how much change was built into that bill. And a lot of that, I think, is because there was no traditional rulemaking or statutory process, right? That bill happened, when we talk about the ACA, and there was all that debate about how, nobody could have really read it in time. Like, the CAA happened in hours. People took like the wrong version of a bill and stuck it in. It's 5,500 plus pages long. It happened in truly hours, and suddenly it was law. And it changed things dramatically. And we are just now, years later, starting to realize the implications of how much of our healthcare landscape has changed from a regulatory perspective, or will be changing as a result of what happened there.
All right. So what's top plate for you? What do you think should be top plate for the advisors who are in the room with us?
Right. So a lot of this, it makes me think of that old urgent and important matrix, right? So I hate to focus too much on the tyranny of the urgent, but I'm going to have to for a minute, because we've got one that's just plain urgent right now. And that is RxDC reporting. And I'm sure there's some people on this call right now who don't even know what I am talking about. But RxDC reporting is a new mandatory federal filing. The first rounds of it was due back on January 31st, but the second round of it is due on June 1st. And it is the second round where CMS and the Department of Labor are going to start getting very, very serious about it. And it is the second round where we are seeing more and more emphasis on what employers and sponsors need to do. And as advisors, everyone's always asking me, what do we as the advisor have to do? Like, what's our job in all of this? Like, what's my legal obligation? And I always say to them, well, you don't have a legal obligation. That's not the issue. There's some legal obligation, but it's minor. I don't want to talk to you about your legal obligation as an advisor. What I want to talk to you about is, what's your obligation as a business person? So you're going to call yourself the advisor. You're going to hold yourself out there as the advisor. What is your client's expectation of you? So if you're going to be their advisor, what do they expect that you're going to do? So let's talk not about your obligation. Let's talk about what your client has to do and what their expectation of you is. Because the way that all of this law works, fundamentally, at the end of the day, is that the Department of Labor has jurisdiction over employers. Employers are the ones who are, at the end of the day, responsible for everything. Who does that employer look to tell them what to do? Because let me tell you, I am not their first phone call. Okay? They do not have me on speed dial. They've got you on speed dial. You as the advisor, and you hold yourself out to be that primary point of contact. You're the primary care, right? So they're looking to their advisor to tell them and to help guide them through this whole process. And just as much as they are looking to you to help them through the financial process, and just as much as they are looking to you to help them understand the nature of the healthcare system, they're looking to you to help them understand what they need to do to navigate these regulatory processes. All right, so back to RxDC reporting. This process is pretty extensive reporting from the PBMs on where pharmacy dollars are being spent. I could go into a whole thing on it. I'm not going to do that today. Top 50 most expensive drugs, top 50 drugs that increase in cost the most. I have a white paper on it if you really want to know the details. So there's a pharmacy component. There's also a component that TPAs need to handle about where medical claims dollars are going. There is also a piece about how premium dollars are being allocated, and in the self-funded world, just how claims dollars are being allocated as between employee dollars and employer dollars. What we have been finding in the past few weeks, not months, is that TPAs and PBMs who are taking responsibility for reporting on the parts that they have the data on are not taking responsibility necessarily for the piece of the reporting that is, what's the breakdown between employee and employer dollars? And they are saying, employer, you need to do that reporting. That reporting is due on June 1st. And if the employer is going to be stuck doing it themselves, they've got to figure out how to do it themselves. Okay, what's that mean? Well, there's a very complex government reporting system that they have to go in and figure out how to use. Ever known somebody who makes widgets who really wants to go in and figure out how to file through the CMS IO system? Number one. Nelson, I can't hear you. I don't know if that's just me or everybody.
No, I had myself on mute.
Oh.
I just recently did our census report for the census department on my company, and that wasn't really hard, but there was a lot that I had to do and a lot of information I didn't have right at my fingertips. So just having done that, I can only imagine what an employer would be facing if they're having to pull pharmacy spend and break it down employee versus employer.
Yeah. So the good news with this is that it's aggregated spend. So what the employer needs to make sure is happening, they got to make sure their PBM is doing the PBM's part. And they got to make sure the TPA is doing the TPA's part. Hopefully the PBM or the TPA is doing the piece that requires saying, allocating which portion of the total spend is employee dollars versus employer dollars. If they are not, they need a solution. They either need to file themselves the piece that is that breakdown of employee versus employer dollars, or they need a partner to do that for them. The reason that I put this at the top of our conversation is it is due to CMS by June 1st. And I don't think they are going to delay it again. My gut instinct is that they are not. They might, but I don't think so because the deadline is statutory and they already delayed 2020 and 2021. And they are facing an incredible amount of pressure from Congress.
Jen, let me ask this. How many employers know that they have this deadline looming?
Not that many. And that's a big concern. I will tell you that we're starting to see traction around it and people are starting to know and there's starting to be conversation around it. I do expect it's going to be an area where there's a fair amount of non-compliance over the next couple of years. And hopefully we'll see CMS taking a compliance perspective in their enforcement regime, which basically means when people don't do it, instead of going out and penalizing them, they try to help them do it rather than starting to assess penalties. But that's not at all clear. And so when we look at government agencies and they say, okay, what's going to happen to me if I don't do this? Because that's always the question, right? I'm not naive. I've been around a long time. That's going to be the next question. Well, what happens to me if I don't do this, Jen? I know that's what you're thinking. It all depends on a number of different factors, and it all comes down to how much pressure are these government agencies under. So they do have general penalty authority. There's no specific penalties associated with this, but they've got like $100 per person per day penalty authority that they got big hammers that they can use if they want to use them. I don't think they're going to take those big hammers out, but at the same time, if they don't do anything, they've got Congress breathing down their neck. And the reason for this reporting ultimately is Congress wants to know why is healthcare why is cost of healthcare outpacing regular CPI by so much? Now, you and I and all the people joining us today have lots of good answers to that we could give them that don't require this crazy new reporting regime, right? But they think that this crazy new reporting regime is going to answer this question. And so the regulators are facing a huge amount of pressure to get this reporting right. So they're not going to be super generous and nice about employers who just don't do this. So I'm taking a good faith posture. So when clients come to me or when advisors come to me and say, do I really have to do this? The answer is not, it's okay to ignore this one. My answer is, you really do need to show that you're taking some good faith efforts to get this thing done. Like, because CMS and DOL are under extraordinary amounts of pressure from Congress, and that changes how they behave. This is all human dynamics, right? At the end of the day, how much pressure they're going to put on their constituents being employers here, is directly related to how much pressure their clients are putting on them, and their clients, Congress.
All right, so let me ask Jan, what is your counsel to these advisors? What do they need to do?
They need to talk to their clients about this, and they need to make sure this is getting done. So they need to be checking in with their TPAs and their PBMs and seeing, are you doing this? So basically the way that this works is there are 8 data files that need to be done. They're called D1 through D8. You need to ask your PBM and your TPA, are you doing RxDC filing? Which files are you going to file on our behalf? Ultimately, for each group, you need to make sure that D1 through D8 are getting taken care of. I would anticipate that for PBMs do meet D3 through D8, your TPA should be doing D2. Hopefully, somebody is doing D1 for you. I'd like to see the TPA taking care of D1. A good TPA should be doing that also. If they are not, the employer needs to do D1 on their own, or you can find somebody else to do D1 for you. I can do a D1, MZP Consulting does D1s. Employer can do D1 by themselves. It's not impossibly difficult, but it's a pain in the butt. So there's options. But what I would say for advisors to do is make sure it's happening and make sure that you have an answer for D1 through D8.
Jen, is there a checklist or any sort of kit available for these advisors so they sort of just are able to go down that list?
There is. So we have a white paper been floating around for about a year now. I'm happy to get it to anybody who needs a copy. What I will do, Nelson, is I'll make sure you guys have a copy after this, and then they can request them directly through me or through you.
Okay.
But we have one. Yeah.
Let me ask you to do something, Jen. The signal out there is sketchy. Why don't you kill your video so that your audio isn't getting garbled?
Absolutely.
We hate to miss seeing you work, but that should help.
Is this better? Yeah.
Yes, much. Keep going.
Okay.
All right. So there's some questions, and I'd like to go ahead and answer these questions now on this particular topic before we move to the next. What groups does this reporting apply to?
All of them.
Are fully insured carriers filing all pieces for fully insured clients?
Not all of them are. So we have seen a number of fully insured carriers come out and not be willing to do D1s on behalf of their fully insured carriers, or on behalf of their fully insured clients, or have unreasonably early deadlines for their fully insured clients where they want information back for their D1s early. So for example, UHC's deadline for information for D1s was March 10th. So if you've not gotten back to UHC with information that they need for the D1, for your fully insured groups, they won't do the D1 anymore. That might change,
Okay.
but as of today, they're not. Care First in the Mid-Atlantic says they won't do it for any of their fully insured clients. So you got to check even with fully insured groups.
Okay. One of our former mastermind partners, Debbie Ryder. Hey, Debbie, says, so you're saying on fully insured where the carriers are doing it, those employers will have to tell how much they charge the employees in total for their insurance for the calendar year, which may be different than their benefit year, correct?
Yes, it is a calendar year reporting requirement. And even though that is not necessarily their benefit year.
Okay. And this applies to all size groups.
It applies to all size groups.
Okay. All right. And several of you asked about the checklist. We'll make that available to everybody who's on this live cast today. Another question, does it apply to entities not subject to ERISA, such as public schools?
Yes, it does.
Okay. All right, so those are the answers to the questions that I see here. Okay. After the RX issue, what's next on what's the next plate down got on it?
You know, Nelson, I'm going to go to the next one, but they're not going to like me anymore. I like people to like me. This is going to be like a parade of horribles today. It's gonna be sad. I just want to, okay.
Sorry.
It's okay. Just don't shoot the messenger. All right, folks. We're going to have to talk about mental health parity again, because it is not ending. It is only getting
crazy. That's crazy. Go ahead. I'm sorry.
I know. We can't help ourselves, right?
I know. Go ahead.
I know. So mental health parity and mental health parity enforcement, I feel a little bit like Chicken Little, but it is still so high up on the Department of Labor's enforcement priorities. I cannot stress this enough. So just as a reminder to everyone, the CAA had a provision in it requiring all health plans to do an analysis demonstrating that their non-quantitative treatment limitations were in parity. So as a reminder, a non-quantitative treatment limitation is any sort of barrier or limitation on access to care that is not quantitative in nature. So quantitative treatment limitation is a little easier to wrap your head around. That is something like a copay, co-insurance, deductible, out-of-pocket limit. Non-quantitative treatment limitations are things like prior authorization, utilization management requirements, formulary designs on the pharmacy side. And when we do a mental health parity analysis, basically what we do is we look at a plan in 6 different categories. And those are inpatient in-network, inpatient out-of-network, outpatient in and out of network, emergency care, and prescription drug. And we look at each of those different types of limitations, and we analyze how we came up with those limitations and if they are in fact being applied in parity as between medical surgical benefits under the plan and mental health and substance use disorder benefits under the plan. The analyses themselves are really deep dives looking at in detail what limitations are, what is actually happening, like in operations. So looking at something like what percentage of prior authorizations are approved on the medical surgical side versus what percentage are approved on the mental health side. How the prior authorization standards were determined, what sort of medical research was looked at in those things, and really deeply analyzing if in fact parity exists on each and every one of those categories. It's a lot, Nelson.
Can you give us a couple of examples to illustrate where parity is not happening?
Absolutely.
Under current plans.
Absolutely. So one example would be something like, pick something like ABA therapy is a huge one that comes up over and over again. So ABA therapy, you see a lot of, I'm gonna pick a couple of different pieces relative to ABA therapy. So one would be an exclusion of ABA therapy where a plan does cover treatment for autism. So a flat out exclusion is typically done based on price. And then you will not find any other comparable exclusions of therapies that range across all other outpatient therapies on the medical surgical side for a plan, and there will be no basis for having done that. And so that exclusion doesn't hold up as being an exclusion under a plan by itself. And so that typically will fall down as not being allowed. Interestingly enough, a complete exclusion of autism will work, and that would be allowed, autism treatment, if you can prove that no treatment for autism exists ever and is ever paid for under a plan. But that is seldom possible, because what you will often find in a plan is that, in fact, it does pay for medical and surgical treatments related to autism. And so that doesn't often happen. Or you'll see a scope and duration limit where certain ages you'll have treatment limits on. But again, it doesn't hold up on the medical surgical side. You'll only see it on the mental health substance use disorder side. So
And
that's
when
an
it's
example of
when it's
something that
only,
will-
and Jen, when it's only on the mental health side, that's the problem.
that's the problem, is that it's only on the mental health side.
All right. So the old limitation on number of therapy, talk therapy, psychiatric therapy visits, that limitation, there's no equivalent on the medical side there either, is there?
That is a quantitative treatment limitation. So that also fails, but it fails under a whole different test in a whole different way. So quantitative treatment limits fall under a whole different process.
All right. So let me cut to the chase. What do we do about it? What do these advisors, how do they help their clients? What is their responsibility, and what are their options?
These analyses have to be done. In most cases, the vendors have yet to do their part in what needs to happen. And so what is happening, I'm going to say still probably 80% of the time, is that a vendor will be engaged to do the analysis, which is now legally required. And you'll end up with an analysis that is somewhat incomplete. Issues will be identified and can be fixed, but a comprehensive analysis, you're not going to get a clean bill of health on mental health parity yet, because TPAs and PDMs have not done their full due diligence on what needs to be done. But what's really important to remember about ERISA and the compliance law in employee benefits in general is that it is a procedural process based on fiduciary duties. And I think that we forget that a lot of the time in doing what we do. And we say, well, if we can't be perfect, then we don't need to go through the process. But compliance in this space is all about process. And so we need to engage in the process of evaluating our plans and looking at mental health parity. And I would say that probably 90 to 95% of the plans that I work with still have not begun the process of really taking a deep look at whether or not they are in compliance with mental health parity. And they've done that for lots of reasons. It's too much money. The vendors haven't done their part yet anyway. I don't want to. There's too many things on my list. There's lots of reasons. But the DOL cares. It also matters, because there are still lots of relics of old things in these plans that just aren't in parity from a mental health perspective. And I don't think that that's any employer's intention in these days. But this needs to be done. It's important, and it's really time to start critically thinking and evaluating how this is going to be approached moving forward.
All right. So let me grab a couple of questions here to maybe see if we can make this muddy picture a little less muddy. Terry Shook, who is an advisor in our Next Gen Benefits Mastery track, asks, what's the process to deliver mental health parity analysis to the DOL?
So they don't have to be turned into the DOL. They have to be created and maintained in the employer's file. And then they are available to the DOL and participants, which means plaintiff's attorneys, upon request. So basically what you need to do is perform the analysis, maintain it in your file, and act upon it based on the recommendations provided.
Oh, who's going to provide the recommendations?
Whatever consultant is hired to do the analysis.
Oh, so this is not a do-it-yourself project.
Typically not. You'd need really sophisticated internal expertise to do it yourself.
Okay. Go back to two words you mentioned. You said do the analysis, put it in your files, and make it available to, it started with a P.
Plaintiffs, attorneys.
Yeah,
Yeah.
tort lawyers.
Tort lawyers. We don't like tort lawyers, Nelson.
Well, unless you're in the class, in which case you might like them very much.
Yeah, I don't like tort lawyers.
Your thinking is this is going to be a very rich vein for the tort bar to mine?
Absolutely. We've already seen the cases begin to be filed.
Well, how are they filing if there's not a deadline? I mean, or does that matter?
It doesn't matter. So what they get access to is the analysis of what's wrong with the plan. So if you can get an analysis, so when you file an ERISA cause of action, you can get access to the plan document, you get access to the annual report, which is really a 5,500, not very exciting. Okay, now you can get access to these documents that are required that go into this, analysis of whether or not you're in compliance with mental health parity. Well, the last thing that you want as a plan sponsor is somebody to ask for this and you haven't done it, and then you go and do it and you find out you have a major problem that you have not fixed, because then you haven't fixed it.
Oh, okay. So let me, there are a couple of questions here, and then I want to ask another question. Two questions from advisors in the room. So Debbie Ryder has another question. What about carriers that are requiring patient notes in order to pay a mental health claim when that's not required for medical treatment?
That gets into the utilization management processes. And that would be something you would look at in an NQTL analysis, is the standards that are being applied. And that would be something that would be looked at there. Like what is the stringency with which you are looking at in a claims paying procedure?
Okay, so that is not necessarily.
That's not necessarily a failure, but we would have to look at it in detail.
Okay. All right. That's a good question. And then let's see. Oh, Tim Hawley, who is at Ascend, says, what are the consequences if the parity ratio seems lopsided? Are these ratios required to be reported by a TPA, and how often?
So if the ratio is lopsided, then we have to kind of look at why. You could have an operational failure there, and it's something that the plan sponsor needs to look into to understand if the plan is in fact in parity operationally. As far as the TPA's requirements are concerned, ultimately the plan sponsor is responsible for making sure that their plan is in parity. So the plan sponsor needs to make sure the TPA is giving them the data that they need to make sure that their plan is in compliance. So required to be reported by the TPA is an interesting question. So legally required? No, but the plan sponsor needs to make sure their plan is legally in compliance. And so as a business matter, the plan sponsor is going to require the TPA to give them the information that they need over time to ensure that their plan complies. So as plans get more sophisticated, they will require that information of their TPAs.
We have a lot of Ascend attendees in the room today. Bill Schmaltz wants to know, other than the TPA, who can help provide the NQTL analysis? I've seen cost from $5,000 to $7,000. Any suggestions on who can do this and at what costs?
So me, I do that. I do this. Law firms do this. There are other vendors in the marketplace that do this. 5,000 to 7,000 seems a little on the low side. They range, I think that's the lowest that I've seen. Mine range from like 9,000 to 15,000, depending on the complexity of the plan. I've seen them run. Some of the alphabet houses charge 50 to 100,000. These reports can range from 100 to 200 pages long. It is a really complex endeavor. But I would remind everybody how much it costs to run a health plan and how much a knee replacement is.
There's a comment here. Even the DOL in presentations have shown that they don't know how to review this at this point. And then another, I don't even know that, you may have a comment on that. Another question is,
they're getting much better. I've had a lot of closed door meetings with them. They know what they're doing. They're working their way through. The statute is very difficult, and they're working directly with the practitioner community. It is hard, but I have a lot of respect for the senior officials of the DOL who are working on this.
So what are the fines for not staying compliant with this, for being out of compliance?
The DOL does not have direct statutory, they don't have direct statutory authority to assess fines. The issue is that they do have the ability to get you to re-adjudicate claims, and they can make you go back for years, many, many years, and re-adjudicate claims. And there are those plaintiffs' attorneys, and there's always that $100 per person per day penalty, and we've seen that be brought up in courts as well. There is also public shaming as an option, because the Department of Labor is required by law to report the people who failed their audits to Congress, and Congress is required to publish a public report. It always makes me think of that scene from Game of Thrones. I don't know if anybody watches Game of Thrones, but there's a particular scene in Game of Thrones. So every time I get this question, I can't help but see that scene. And if you watch the show, you know the scene I'm talking about.
Which scene?
Scene where she's walking down the street naked. Okay, anyway.
Oh, the shaming scene. Oh, yeah, yes.
The shaming.
Where Cersei is, yes.
Yeah. Public shaming.
It's almost visceral to watch that.
Yes. Nobody wants their name in a public report to Congress, believe me.
So this is something that MZQ can do. It does. This is something MZQ does. And the real risk, it seems to me then, is especially for deeper pocket companies, larger deeper pocket companies, the risk of being named in a class action lawsuit.
Class action lawsuit and public shaming. Don't underestimate the power of a newspaper.
Oh, forget that. Wait till it hits social media.
Correct.
That's when it gets bad. That's when it gets
the
viral.
DOL is also actively seeking statutory penalty authority. So each of the every time a bill is actually going to pass Congress, like right now, everybody wants their Christmas ornament. So every single bill that looks like it's going to pass, every spending bill, everything that has gone up to Capitol Hill in the past 2 years, there has been a request from the DOL for statutory penalties associated with mental health parity. They have come out the last 3 or 4 times. We've been working actively through NABIP to try to get that. We haven't gotten it. It hasn't gotten in yet. We've gotten it taken out each and every time. Doesn't mean we'll be successful in the end.
Okay. So
we'll keep trying.
So for their clients, they need to have a conversation about this. Explain the risk, explain the situation, explain the risks, and then provide them with a service that will get this job done for the self-funded client in particular. Is this the responsibility? If you're fully insured, what liability does the employer have if they have a carrier plan?
I'm not real worried about the fully insured groups.
Okay, so this is really a self-insured issue.
Correct.
Okay. So if any advisor listening in this room who has self-funded clients needs to sit down, have a conversation, explain what's going on, the risks, particularly of litigation and bad press, bad PR, and give them an option to have someone do this analysis and have this paperwork available to put in your files.
Absolutely.
Okay. All right. Then let's move on to your next topic, which is the employer mandate updates around ACA.
Right. So I just can't get through like a first quarter without bringing this up and reminding everybody that it's still there. It's still happening, and just to keep an eye out around ACA enforcement. So we're seeing a lot of it happen. Just a couple of warnings and reminders here. One is that the biggest thing in my mind is that the affordability threshold went down below 9.5% for 2023. So as a reminder, in order to fully comply with the employer mandate, employers with 50 or more full-time employees have to offer affordable minimum value coverage to their employees. And to be affordable, that means the coverage technically can't be more than a percentage of their total income, their household income. That percentage has always been 9.5% adjusted for inflation. This year, it is that inflation adjustment makes it 9.12%, which is less than 9.5%. It's a lot less than 9.5%. I am fully expecting people to have not paid attention to that and end up getting stuck with penalties that they were not expecting. A reminder, it's not too late to fix those things if you need to fix them, because ACA penalties are assessed on a monthly basis. So if something went wrong in your affordability calculations for 2023, you could still adjust your employer contributions and fix them now and cut off penalties for April through December. So I just want to remind everybody of that, because I think that we're going to end up with a lot of unanticipated 2023 penalties, Nelson.
Are they actively enforcing this consistently?
Yes. Very actively enforcing it, very consistently. They're also actively enforcing the reporting requirements. We get penalty letters in at MZQ Consulting all the time for people who didn't file. Those clients who go above 50 and never filed and then forgot that they went above 50. Reminder that 50 is counted on a control group basis. So suddenly they just, acquired another company and went above 50 and forgot. We never did our ACA reporting since 2015. That happens all the time too. When ACA first passed, everybody learned about ACA and there were all those webinars and everybody talked about it all the time. It was all very exciting. And then we kind of all forgot what we learned. And I can't tell you how often we end up with 5, 6, 7-figure penalties coming into our office for really basic ACA mistakes. But it is extraordinarily actively enforced by the IRS. This is not a DOL thing, this is an IRS thing. They are very good at enforcing it. They are very active at enforcing it. We don't have good faith compliance anymore. And they mean business.
Okay.
They mean business.
then I'm hearing there are really three areas now that require a conversation to not to turn all of these advisors into compliance officers, but the point you made earlier is when they do get a fine letter or a letter from the feds for anything, they're going to look to the advisor. And we know that. So, managing expectations is an incredibly powerful tool, right? If you go in and have the conversation, your client chooses not to invest in an analysis on their mental health parity, you ought to consider having them sign a waiver that you in fact notified them and that you are that they are accepting responsibility for any consequences, because if we all know how easy it is to find a scapegoat, and you're going to be the scapegoat. All right, so Jen, the prescription drug reporting, mental health parity, and now the updates around the changes around the ACA requirements. Those three.
Those are my big three right now.
Okay.
Which is not to say there's not more. We've spent a lot of time over the past couple of years talking about transparency, and I could talk to you till I was blue in the face about those, right? And we've talked a lot over the past couple of years about compensation disclosures. That didn't go away. Transparency disclosure hasn't gone away. It's a lot right now. All of this was in a bill about surprise billing. That hasn't gone away either. Somebody could make a career out of just these compliance issues, Nelson.
Who would do that?
I don't know. You'd have to be certifiably crazy.
All right. There was another topic, transparency, all of the various transparency regulations on the employer, on the employer to get the advisor broker to be transparent around compensation and services, then the hospitals around their pricing and procedure pricing, and then the insurance companies around their price arrangements with the providers. What's the latest on that?
The latest is the advanced DOB stuff. So these are supposed to be going live now, essentially. The ability for participants to go in and figure out ahead of time, before they go into the doctor, what basically, an estimate of what their cost sharing would look like. And those are supposed to be going live as the first day of the plan year in 2023. We've seen low levels of compliance around that, but I just want to make sure folks know that the first phase of that, for the first, I want to say 300, maybe 500 items and services, is supposed to be this plan year, and then everything for next plan year. But we are, looking for that, and that is supposed to be going online this year as well. So that entire regime, this year and next are the final pieces to that, fully transparent puzzle, as it were, coming together. We're a long way from full compliance on transparency. But it is supposed to be that the final pieces are coming on board this year and next.
So I'm personally, and I guess that has a lot to do with my role working with these advisors. But what is the current state of the employer required at broker compensation and services disclosure? How is that happening? To what extent is it happening? Have there been any repercussions or consequences to date?
Technically required. It is online. Everybody's supposed to be doing it. Employers are supposed to be self-policing it at the moment. We have seen no active enforcement against employers around it. That's where the policing would be. So just as a reminder, the DOL is the one who has jurisdiction over this, and the jurisdiction is relative to the employers. Now, I was at a meeting with Amber Rivers, who's the head of the department within the DOL, who has jurisdiction over all of these things. And what I will tell you is, there's one woman at the Department of Labor. Her name is Amber. I like her very much. Amber has jurisdiction over all of these things that we talked about today. She has a lovely department of about 15, 20 people who are responsible for all of these things that we talked about today. Broker compensation disclosure and the RxDC stuff and the mental health parity stuff. Got like one little department of 20 people who are supposed to be doing all of these things. And they are humans, and they can only do so much. And, you know, that's all that they can do. So, short answer to your question is, there's no enforcement happening yet.
All right, so let me offer my advice, Jen, to the folks on this call. If you are a next gen advisor and you are working primarily on fees, and especially if you're putting your comp at risk to guarantee results, but even if you're not, and you are transparent in your compensation arrangements with your clients, it behooves you to go and remind your prospects that the Department of Labor requires them to require of their broker a compensation disclosure form. And because it will reflect well on you, it probably won't reflect well on the incumbent if they are not next gen. So that's my piece of advice. Jen, we've got some questions that didn't get answered and have come in since we stopped answering questions on the RX piece. Going back to the prescription piece, Bill Hughes wants to know, one of our mastermind partners, does anyone it does not apply to the pharmacy requirements? Any
Not
groups?
really, no.
Okay. All right. Is the report based on average employee Now this is
Based on what? I'm sorry.
Is the report based on average employee premium or the total monthly premium for the group?
The report is based on the total premium spent over the course of the year.
Okay. I think that answers that. Is there any type of program to test compliance?
Not sure that I'm following that question.
All right. If it was an anonymous attendee, so I can't tell you who, I can't call you by name and ask you to elaborate, but if you are still on and want to elaborate on that question, we'll put it back in front of Jen. In terms of the prescription piece, what if the fully insured carrier only reports on an aggregate basis? Will this still fulfill the employer reporting requirement?
No.
Okay. And then Mark Holland, former mastermind partner, has the, hello, Mark. How about BUCA level funded health plans? They are self-funded. So where do they fall?
I'm not sure if this is about mental health parity or RxDC, so I will answer it relative to both.
Please.
They absolutely have to do their own RxDC reporting. I'm not super worried about them relative to mental health parity.
Okay. Do you have to update the mental health parity on file every time you change TPAs?
Absolutely.
Okay. That's a yes. Does the compensation disclosure apply to other vendors around the health plan, PBM, TPA, et cetera?
Not some of them. There's a specific definition of the things that you need to be doing in order to fall into that process. So it depends on if you meet that definition or not.
Okay, well, that's clear as mud to me.
I know. Well, you ask a lawyer a question, you expect a straight answer. Come on, I've given you how many in the past hour? I get.
No, that is why you are so beloved. Is you speak English, not legalese, and you do give straight answers most of the time.
I mean, it's been a long. I'm on like my flight got canceled. I'm in an airport. You got to give me one or two.
And you had a very expensive room at Paris last night.
Let's not even talk NCAA tournament, like major conferences. It's a lot. It's a lot. My clothes are in Baltimore. I'm here. Yeah.
Well, I'm glad you got your laptop or your iPad. Does the compensation disclosure apply to public schools? It's any client, isn't it?
It is. Yeah, it does. Most of the stuff, the CAA it is not ERISA. Like, I mean, some of it's ERISA, but not all of it's ERISA. I think it does.
And then, will this recording be available in the future? The answer is yes, it will be. We'll make it available to you. And let's see, Tim Hawley has another question. If multiple agents in a hierarchy are involved in a plan build, is comp disclosure required from all levels or just the agent of record?
So all of the comp needs to be it's an excellent question, A+ question. All of the comp needs to be disclosed. How that disclosure is done is up to the agents to decide. Really, it's up the plan, the fiduciary, the employer needs to make sure that they get all of the comp disclosed. So exactly who and how it gets disclosed can be worked out amongst the parties.
That's going to be a tough one though, Jen, because the agent of record, the broker of record, has no idea who's getting paid above him necessarily, and nor how much, and may not even know how to access that upline to I sound like a
right. So it might be the upline. I know. So it might be the upline having to do it themselves. And then there's a question of the upline even thinks that they're subject to the rule, and certain people in certain uplines don't think that they even have responsibility under the rule. And we could go on for days, but I believe that we are out of time, Nelson. Aren't we out of time?
You want to be out of time? We have
on that question, or we could just pass on that question. Thank you so much for your wonderful question.
Well, it's a great question. All right, let's see here. If they're self-insured, our compensation is already disclosed. Are we required to provide anything additional to the employer? Will questions and answers be included in what you'll be providing? Oh, in this recording? No. The questions and answers, yes, we can get the questions unless they were typed. I think all of them are answered live, but they'll all, yes, all of the live conversation will be in the recording. But Jen, it's if the client is self-insured and compensation is already disclosed, but it's not necessarily all disclosed. You're going to have other forms of
if you have disclosed all of your compensation in a manner that meets the requirements of the compensation disclosure in advance, and there's nothing left to disclose, then there's not an additional disclosure requirement, right? So the disclosure requirement requires that you disclose all compensation and that it meets certain requirements. If that's been met already, there's nothing more to do.
Jen, I'm going to end the Q&A bit before I thank you with this one last, not a question, it's a statement. The employer should demand transparency of all their vendors. And the people said, amen. All right, Jen Berman, thank you as always for bringing some clarity to a very, very opaque area, which is federal regulations. This is why you are our Director of Regulatory Compliance at Next Gen Benefits. Thank you. And I look forward to seeing you in a couple of weeks in Nashville at the Next Gen Benefits Mastermind Summit.
My pleasure. And hopefully next time I'll do this, from my desk. My apologies for any airport background noise, but I'm glad I was able to join nevertheless.
We appreciate it very much. Everyone, thanks for joining us here in the Healthcare Lounge for Next Gen Benefits. I'm Nelson Griswold, and we'll see you next month.
Be well, everyone.